Disorders, always the funnest part. So we're going to start disorders of the endocrine system, and we'll do this for 2 days. So we'll do the first half today, and then we'll finish up disorders tomorrow, I believe. So the first one, good news is that I know that the pituitary gland had like 8 gajillion, real number, hormones that it released and that affected the body. But there's only going to be a couple that we're going to do for the pituitary gland. So the first one is called gigantism. It sounds like it's made up, but it's legit a thing. It is where you overgrow and become gigantic. So gigantism is due to, no big shock here, too much growth hormone. And one of the big things about this is that it has to be that the pituitary gland makes too much growth hormone. So hyper secretion, over secretion, too much growth hormone in children who are still growing. You're going to see that there's another version of this that happens to adults, and it ends up looking very different just because as a kid, you have the potential to still grow and become gigantic. But once you're an adult and you're done growing, it's not going to affect you the same way. So gigantism is hyper secretion of growth hormone in kids who are still growing. Don't worry about why, but just so you know, it's generally because they have a little tumor on their pituitary gland, not cancer, but just like a benign, meaning non-cancerous tumor growth on their pituitary gland. So symptoms are going to be excessively tall. They get gigantic. So this is a picture of what was supposed to be identical twins, but the patient, the young man on the left, had a pituitary tumor that caused gigantism. So yeah, pretty obvious there what happened. This one not, this one gigantic. Just so you know, it doesn't only cause like the long bones to grow, which is what you're seeing here and why this guy's so tall. It can also it can megaly your organs. And remember, we like it when muscles get big, but pretty much everything else doesn't work quite as well when it gets big. Actually, if you think about it, who lives longer, little dogs or big dogs? Little dogs. Big dogs don't live as long, and it's really kind of similar. When you stretch a heart and make it big, and when you stretch a liver and make it big, it doesn't work quite as well. So the treatment is we're either going to cut off the tumor, or we're going to give you some medicines to block the growth hormone or try to shrink the tumor. Don't really worry about it. What I want you to know is gigantism, too much growth hormone, super, super tall. And other things get big and it's not good for you. Oh my gosh, I forgot about this. Hey guys, do you know who this is? This guy's called Andre the Giant. He was giant. When I started making this slide, I thought, I wonder if Andre the Giant, and I looked it up, and sure as the flippin' world, he had gigantism, which is super cool. So he was a wrestler. Oh my God, you know what? The 80s were a different time. Don't judge this man. But he's in my favorite movie of all time, Princess Bride. It was one of my favorite movies growing up. If you haven't seen it, please watch it. That is your homework. Just kidding. But seriously, what else do you have to do? Moving on. Next comes acromegaly. So megaly means to get big, and this is where same thing. You have a hypersecretion, oversecretion, too much growth hormone, but this happens to people who are already done growing up. So caused by the same thing, usually a tumor on the pituitary. And the symptoms are that they gradually get bigger, but they don't get bigger like height-wise because they're done growing. They get bigger hands, they get bigger feet, they get bigger lips, they get bigger nose, and their chin and brow start to get bigger as well. So this is, I don't know why they order it like this. This is the before and this is the after. And a lot of times this is how people realize they have a problem. They'll start looking through pictures of themselves and they'll be like, whoa, wait, something's weird here. So this is probably maybe 5-10 years difference. And you can see the big nose, the big lips, chin even got bigger. I can't tell because of this tragic bang choice, but her brow could have gotten bigger as well. Hands and feet as well, but not pictured. Again, everything, it enlarges organs as well, and that's where it gets dangerous. It's going to have the exact same treatment as the other one. So gigantism, too much growth hormone as a kid, all of you gets big. Acromegaly, too much growth hormone as an adult, weird things get big. Opposite of both of those is growth hormone deficiency. So everyone, when I'm asking questions about this, you're like, I don't know, it's that one where you don't have enough growth hormone, but I can't remember the name. It's because it doesn't have a fancy name. It's just called growth hormone deficiency. Deficient meaning you don't have enough of it. So this is hypo, so the opposite, too little secretion of growth hormone. And again, it's in childhood. It causes one of the types of dwarfism. Idiopathic meaning, that's right, we have no idea what causes it. So, short stature and delayed or no sexual development, meaning that it takes them a lot longer to hit puberty, and sometimes they will not hit puberty. They will never be able to conceive children. So I will say that this is a drawing, not a real picture. This would be the same girl, how tall she's supposed to be, and this would be her with growth hormone deficiency. There are multiple causes of dwarfism. I believe that anyone who is under 4'10" technically is considered a dwarf. There are proportionate dwarfism, which is what this is, where your arms and legs are the same relative to your trunk and head. And then there's improportionate dwarfism, which a lot of those are genetic disorders where you see the people who have like normal sized trunks, but larger heads and short legs, that type of thing. But this is proportionate, so you would just be shorter. In order to treat it, we just give you synthetic, meaning man-made growth hormone. One of my mom's friends had this. They measure you as you're going to the doctors as a kid coming up, and she was tracking to not be more than 4'10". So they started injecting her with growth hormone. They got her to 5 foot, and once they got her to 5 foot, they stopped. Okay, so the next two glands that we'll talk about today, the disorders that can happen to them, are the thyroid and the parathyroid. So starting with thyroid, remember the thyroid was the butterfly in the front of your neck that released thyroxine, which was basically your metabolism, how quickly you burn food and turn it into energy. So obviously hyperthyroid is going to be too much metabolism. So oversecretion, hypersecretion of thyroxine causing increased metabolism. I know what you're thinking. Oh my God, sign me up for this one. But just wait. So first of all, symptoms are weight loss despite eating more. I know what you're thinking. Miss Michael, sign me up. I'm ready. Nervousness. You know what? I'm already high anxiety. Whatever. I can deal with it. If I can eat 3 pizzas in a sitting and not gain weight, it'll be worth it. Increased heart rate and blood pressure. I mean, maybe it's still worth it. Exophthalmos. This is where they lose me. So exo meaning outside of, and ophthalm means eyeballs. So this is a fancy word that means your eyeballs bulge out like that. I know what you're thinking. She's just surprised. She can shut her eyes. Bam. No, never mind. I'll just eat a reasonable amount and continue going to the gym. So yes, the weight loss despite eating more. Nervousness relates to the metabolism. So when you burn food, you get energy. And if you have way too much energy in your body, a lot of times it's interpreted as you feel nervous. You feel like, you got to tap your foot and you feel weird because your heart's racing and your blood pressure's high and you don't feel right. And it causes all this anxiety because you don't know why you're feeling that way. This, we don't know why it happens. We have no idea. Also, you can get a goiter. So if you were really, really like, you know what, whatever, I'll deal with it. I'll wear sunglasses all the time. The goiter is an enlarged thyroid. And remember that your thyroid is in your neck. So bam. This is a very severe goiter. I mean, this is real severe. Like her neck looked 8 months pregnant. I can't even. This is real, real bad. So this is pretty rare. This legit does happen though. All right, so treatment. It sounds sci-fi, but we've been doing this for a really long time. It's actually quite safe. We give you radioactive iodine pills. So this is going to be something I want you to remember, that your body needs iodine in order to make thyroxine. So just like you need chocolate chips to make chocolate chip cookies, you cannot make thyroxine if you don't have enough iodine. Think of it similar to like if you don't have enough iron, you can't make red blood cells, and so then you have anemia. If you don't have enough iodine, you can't make thyroxine. And that'll play into the next disease that we're going to talk about. But for this, if we give you iodine that's radioactive, your body absorbs that radioactive iodine into the thyroid gland, and then it kind of starts to shrink, almost like think like radiation to a tumor. It starts to shrink the thyroid gland. If that doesn't work, We can give you some thyroid blocking pills. And if it's really like this lady, dear God, needs surgery in order to remove part of the thyroid gland. This is really, really rare that we will do this. And the reason is sometimes when we take out the thyroid gland, remember those 4 little dots on the back of it are the parathyroid? If those accidentally get taken out with it, then it's life threatening. It's a really big problem. We'll talk about that in just a few disorders. So hyperthyroid, too much thyroxine, eyeballs and neck stick out, but the more common are the nervousness and the weight loss. So next comes hypothyroid. Hypo being low, thyroid will be low thyroxine, which means low metabolism. So under secretion, low secretion of thyroxine causing decreased metabolism. So the exact opposite of the last one. Again, you have to have iodine in order to make thyroxine. So one big reason that this happens to people is because they don't have enough iodine. Now, I'll say that that's not why it happens in America, because in America, we add iodine to salt, and we add salt to everything. So this isn't one of the common reasons for it happening in America, but in other places in the world that don't add iodine to their salt, in fact, if you go look at your salt, the bottle of it, it'll say iodized salt. It's in order to combat this. The same reason we put like folic acid in cereal in order to help women not have birth defects when they give birth. We're trying to slowly dose you with this, whether you want it or not. In America, if it happens, it's probably an autoimmune disorder. So symptoms are, a lot of them make sense. Fatigue, yeah, well, you don't have a high metabolism. You're not making energy out of food. And because you're not making energy out of food, you're just storing it, you gain weight. Everything kind of slows down because you don't have this energy. So you end up being constipated, muscle aches, all sorts of things like that. These people can also get goiters, rarely, but the goiter is more common with the hyperthyroid. So treatment is, we're just going to give you pills of thyroxine. This is a pretty common one. I had tons and tons of patients that had hypothyroid, and they have this little pill that they're on called Synthroid, meaning synthetic thyroxine, Synthroid, and they take it once a day. You have to get some blood work done, and they adjust your dosage every now and then so that it's the right amount, but it's a pretty easy fix. So the last 2 disorders we're going to talk about deal with the parathyroid gland. So thyroid was the butterfly in front of your neck, and the parathyroid were the 4 little dots on the back of it. And remember that the parathyroid, its most famous job deals with calcium levels, regulating calcium levels. Josh Groban lifts up calcium, blood calcium levels. So if you have hyperparathyroid, so you have too much parathormone being released, you're going to raise that blood calcium level real way too high. And the problem with that, so excessive amounts of calcium in the blood, the problem with that is, remember where your body was getting that calcium? From the bones. So it's going to steal so much calcium from the bones that this was you, and now this is you. These people end up with real bad osteoporosis. Again, usually because of a tumor on the parathyroid, but don't worry about it. Symptoms are osteoporosis. So if you have a little 70-year-old woman who has osteoporosis, she probably just has osteoporosis. If you come across like a 30-year-old who has osteoporosis, they almost certainly have hyperparathyroid. In fact, I dated a guy one time, and he said that his mom was on disability from the time she was like 30 or 40 or something like that, because she broke her bones so easily that one time she like went to open a door and it fractured her wrist. And I was like, oh, your mom has hyperparathyroid. And he was like, I don't know what you're talking about. And he called his mom, and he was like, oh, yeah, you're right. She has a tumor on her parathyroid gland that caused hyperparathyroid. I don't know why they didn't take it off, but we broke up, so I never got to ask. Anyways, back to this. So it can also cause kidney stones because remember from the urinary system that your kidneys are filtering out what your blood doesn't need. So your body knows that there's way too much calcium in that blood. So it tries to get rid of all that calcium and dump it into your urine. And then all those little calcium things stick together and you end up with a kidney stone. So treatment, and again, this is risk benefit like analysis, like how bad is it? Does a strong gust break your bone? Because like that might be the only way that we go to fix it, because it's very dangerous to fix it, because we fix it by removing the tumor or some of the parathyroid glands. And parathyroid, this too much calcium in your blood, yeah, that sucks, But too little calcium, if we remove too many of them, and it's the same reason that we don't take out thyroid glands unless you super, super need it. Because if we take too many of your parathyroid glands away and too much of this function away, it can absolutely kill you. And that is this one, hypo. So the last one we'll talk about today is hypoparathyroid. If you do not have enough parathormone, and so your blood calcium levels are too low because Josh Groban parathormone is not raising up the blood calcium, it's letting it stay low. Low blood calcium is very dangerous. So again, this usually only happens after we have cut out the parathyroid gland. Either because you had the other one, that you had hyperparathyroid and we're trying to get rid of that, or you had hyperthyroid. And so we were cutting out the thyroid and accidentally took the parathyroid with it. So all of the symptoms that it causes are low blood calcium levels. No matter why you have low blood calcium levels, whether it's this or something else, low blood calcium presents with tingling, numbness, cramps, and twitching. Calcium helps your nerves talk to your muscle, and if you don't have enough calcium to talk to the muscle, then you have nerve issues. So tingling and numbness are the sensory nerve, and the cramping and the twitching are the motor nerve. Tetany. This one is dangerous. So tetany is spasms. So this is, and it looks just like this. I used to think that this was just a silly picture, and then I saw people really have tetany, and this is exactly how it looks. So tetany is like, think of like, when you have like a Charlie horse, like a cramp in your muscle, but then it stays like that. And it tends to affect the hands very quickly. So this woman, all these muscles are contracted and it pulls the hand like this, and it's very painful and they can't stop. And then eventually it will progress to seizures that can kill you. This is not the normal type of epilepsy seizures. These are different type of seizures that can keep going and keep going. This is, again, tetany. So treatment, we're going to give you calcium, but remember that anytime we give you calcium, your body can't absorb calcium unless it has vitamin D. So we're going to give you calcium and vitamin D, kind of like your body can't absorb glucose or sugar unless it has insulin. It can't use calcium unless it has vitamin D. So we have to give you both. So the scariest complication for tetany is like, yeah, this sucks, this is painful, but if your airway spasms, if you have tetany in like the throat and of the airway, then you can't breathe and you die. So the seizures can kill you and the tetany can kill you. Hypoparathyroid, low blood calcium levels are by far the deadliest one that we discussed today. All right, that's it for today. Thanks so much, guys. I miss y'all. Go outside, be happy, listen to music. I miss you. Okay, bye.